People of St. Martin, both here and abroad, I hereby address you as Prime Minister and Chair of the EOC in an update for today, Friday, March 27th, 2020, as part of the process to keep the community of St. Martin informed about the latest developments and government's COVID-19 preparedness, prevention, mitigation, and response measures. Yesterday, Thursday, March 26, 2020, I updated you on the joint controls being executed by the police force of St. Martin together with their French counterparts. These controls started today, Friday, March 27, 2020. I have been asking for persons to heighten their awareness of ways to mitigate the spread of COVID-19 and the importance of practicing proper hygiene, as well as social distancing. To protect the population, closures of schools and non-essential businesses have been implemented, and minimized business hours have been implemented as well, all with the intention to minimize movement around St. Martin. While no curfew yet exists, prohibiting movement of the population, each and every citizen is asked to stay at home as much as possible in order to keep yourself and your loved ones safe. To update on the American case, I would like to update the public of St. Martin that the case that has been widely reported on pertaining to a case that a suspect was sent to Miami, this patient was actually one of the French COVID-19 positive patients, which we were updated on during the morning yesterday on Thursday, March 26th. Later in the afternoon, I was notified that a medevac, had been brought to evacuate this patient. The proper protocols had not been followed, and therefore it took a bit longer to be arranged. However, after having ascertained that it was the hospital that had made the arrangements upon the request of the patient was allowed to be evacuated via the Dutch side. The patient did not come in contact with any of our St. Martin professionals. The medevac team took the ambulance to the French side, picked up the patient, came back to the airplane, and the plane departed. No one remained on island from that jet. So the patient in question was actually one of the French patients that had been tested positive. He had been on a boat in the French harbor and had reported himself and was in the French hospital. As such, I would like to ask people on St. Martin not to get caught up in false reports where St. Martin's name is noted. As you may know, persons reporting from the outside are never quite aware of the two parts that form St. Martin, Saint-Martin. We wish the patient much success in his recovery, as well as all those other patients who are currently suffering from the effects of COVID-19. To those persons who have returned to the island since Friday, March 13th, you are still requested to register with CPS by calling 914 or downloading the document provided for such on government's website page at www.stmartingov.org/coronavirus. Please fill it in and email to CPS at surveillance@stmartingov.org and call 914 to ascertain that this has been received so that you can be properly registered in our system. These persons mentioned above should be, at this moment, still in self-quarantine, whether they have symptoms or not. As long as you have a travel history of within the 3 weeks prior to today that you have been out of the island, you are requested to self-quarantine and register with CPS. Self-quarantining requires that the person would remain in their homes, out of circulation of the community, and asking then family and friends to assist them with whether food and or other services. Persons who have flu-like symptoms and no travel history are not automatically considered suspect COVID-19 patients, but should also self-isolate at home and stay away from their family and friends, as well as monitor their symptoms in case they may have been exposed to someone who has traveled. Self-isolation refers to the separation of ill patients from other persons to ensure the safety and health of persons that are not ill. Therefore, if you are self-isolating within your home, that means you are separately in a room away from the rest of your family. If you are in quarantine, meaning you're moving around within your home, all persons within that home would also have to be quarantined with you. If you are self-isolating, but whomever is dealing with you is living in the rest of the home, that person is also asked to remain indoors and have services brought in instead of going out for the duration of the isolation. I hope I am quite clear with this, as I've been getting very annoying reports that persons who should be self-quarantining or isolating are publicly stating that they are not heeding this and either visiting the government's building, the GEBE offices, Telem offices, even the hospital and doctor's offices, which they have been requested and urged not to do. These actions are very, very selfish and actually put the entire population at risk. I am once again asking you, desist from doing such and remain isolated or quarantined in your home, whether you have symptoms or not. I'd like to reiterate that in my national address held yesterday on March 26, 2020, that our healthcare professionals and emergency service providers are tirelessly working, sometimes up to 24 hours a day, every day, to be able to take care of ill patients on a regular basis. Now with the added pressure of COVID-19, everyone is on their P's and Q's and would like to be able to offer service, but of course, the compliance of our general public is required. Several attempts have been made to utilize empty hotels to be able to quarantine and or isolate persons, but that has not been successful. However, I would like to make an appeal to any hotel that is now willing to work with government in this regard to please take up contact with our Tourist Bureau, Ms. Mei Ling Chung, or Health Department, Mrs. Fenner Arnell, in order to facilitate this arrangement as soon as possible. Government continues to explore other options to retrofit other buildings to be able to use as quarantine or isolation for patients or persons who are not complying with the self-isolation agreement as has been agreed upon between the CPS and the patient. I'd like to reiterate that rumors concerning services being offered on behalf of the government should be seen as just that. If the government is offering a service, this will be communicated to you via government's official media platforms or my person or someone from the health department or a doctor. Today, on March 27th, Friday, EOC meeting was held with ESFs 4, 5, 6, and 9, which represent the fire department, police department, health department, including CPS, and the Ministry of General Affairs. In a decision, after the meeting, the decision was made that it was necessary to increase further restrictions on the movement in persons, and the process was started to finalize a ministerial regulation which would regulate such. Once this has been finalized, further measures will be announced. Many persons have contacted me regarding shutting down the island completely. I would like to reiterate to the general public and explain that a shutdown would mean that only pharmacies and supermarkets would be open and that no movement would be allowed by the general public at all times. Unless specific arrangements would be made either for food deliveries or to allow for small periods for shopping to take place. This requires quite some logistical planning as well as an increase in our support that has been requested from the military, which has not arrived. In awaiting that moment, or in fact, our shutdown process in our plan will only come into effect if we have 2 serious cases of COVID positive patients, whereby that would be at this moment the capacity at the St. Martin Medical Center to be able to treat such. The conditions and the measures we have taken thus far have been working. CPS continues to monitor and update daily on the number of persons being quarantined, being isolated, how many have been tested, how many are positive, how many are negative. And to date, it remains at 3 positive, whereby 1 is currently at the St. Martin Medical Center in stable condition, but due to some respiratory challenges, was kept to be stabilized. Meetings also continue today, specifically with ESF 6 and 7. In the meeting with ESF 6, I received an update on all the cases, challenges with communication in relation to the protocols with St. Martin Medical Center, Ambulance Department, and CPS. Therefore, a meeting will be held with the full ESF membership and the GPs in the coming days to improve on the collaboration and cooperation in the interest of public health. From my understanding, there was a glitch, let's call it that, in the protocols that had been established, and erroneous information was given to a patient yesterday. At the end of the day, however, the patient had been seen and assessed and was determined to be able to remain at home. CPS is not involved with this case, as it has not been determined that it is a COVID case. I take this opportunity to request that all qualified nurses, LPNs, and student nurses who are not currently working in the medical field but are qualified to do so, that they are able to call CPS and register so that a pool of backup nurses can be on call to assist when needed. Further information regarding this uproop will be made in a subsequent announcement where specific numbers and email addresses will be given to avoid that they are not bombarded in the same way. In the meeting held with ESF 7, Social Affairs and Community Development provided an update on the plan to assist the most vulnerable in the society. In advance of the expected economic and social stimulus plan, which is still being planned, and of course funding is still being sought. The ESF 7 members were represented in the meeting by Community Police, Community Development, Court of Guardianship, among others, and also being discussed were the assistance they would receive from stakeholders such as K1, community officers or persons within the community councils, as well as other NGOs who are ready and willing to assist in the preparation of food baskets to be able to give to these persons. Some 1,500 have been identified, and the deadline that I gave was to have these baskets prepared by Wednesday, April 1st for distribution. Persons who may have already begun feeling the negative effects of the economic downturn from COVID-19 business closures, loss of tourism-related business, etc., should call or email Social Services Department of Government. Further information as to a hotline number and email address will be announced in a subsequent announcement as well. Such persons will be taken along in the count to be able to provide assistance if received on time. On Saturday, March 28th, in the afternoon, a meeting will be held with the extended members, as mentioned previously, of ESF 6, which is all medical health stakeholders, in order to get a full update and input from all stakeholders in the healthcare sectors. This is in order to ensure that all hands are on deck and the buy-in is there to be able to execute the protocols which have been established and shared with the EOC. As I conclude this address, I ask for something very, very simple. In fact, I have seen and heard many announcements from governments around the world where the pandemic has actually been established, where they have thousands and thousands of cases. While we only have currently 3 positive cases and continue to test according to the protocols established that one should have been exposed to travel within the past 3 weeks or have symptoms, a combination of the both. Testing takes place, and as you can see, only a small amount, 3, have tested positive from those tested thus far. CPS has, of course, quite a number pending results that will come from Guadeloupe at the moment. And as I mentioned before, by next week, we should be able to carry out more testing on St. Martin once that has been accredited by the HRIVM of the Netherlands. They are currently in the testing phase, and I look forward to that. However, simply staying at home can save a life. Staying at home can save your life. If it is not necessary for you to be on the road, going out on the road means you are exposing yourself to unnecessary harm. Yes, people are saying there could be more persons walking around on the island who are COVID but haven't been tested. However, we cannot go around randomly testing persons at this time. As we may see from the international media, there is no random testing happening unless there is a pandemic. We are testing suspected COVID patients, but we can only know about them if they register with CPS. So I'm asking once again, please, if you have traveled and are experiencing symptoms, or even if you are not experiencing symptoms at the moment, please call CPS, inform of your travel history, allow yourself to be monitored, sign on to that agreement, which will allow CPS to hold you accountable for keeping that and keep St. Martin safe. I want to thank all those persons who have reported to CPS in the past few days of neighbors, known persons who have been actually out and about while supposedly on quarantine. We are resilient. Staying at home will help because you matter. We all matter. I'm hoping that you all can hear me and listen and understand that each one of us can make a difference. We are resilient and hopeful people, but we must not be deaf to the heeds that can save our own lives. We will get through this trying period. I am not saying that it will be easy, but we have seen in the past that we have been able to bounce back. What is different this time is that this same pain is being felt all over the world, and in most cases, much worse than here on St. Martin. The Emergency Operations Center, the ESF coordinators, and all their stakeholders are all working in the best interest of each and every one of you and your families. Please follow our government radio station 107.9, look up our Facebook page, our website www.stmartingov.org/coronavirus. Find the information, educate yourself, stay healthy, build up your own immune system, and continue to exercise proper hygiene. When you enter your home from being outside, take off your clothes, your shoes, take a shower, wash your hands before interacting with your family. All these things will help you to keep yourself and your family safe. If you suspect you have been in contact with someone who is COVID positive, call 914. God bless St. Martin. God bless the very compliant people who are working together, government, community, and each and every single one of our St. Martin and Saint Martin residents to keep St. Martin safe. God bless.